I want to start off by saying that feasibility does not begin with surveying sites. I know that's an obvious statement, but it's worth saying because the term feasibility often gets confused. Feasibility actually begins with good, thorough planning. And if we skip this important planning step, or if we do not plan properly, we will perpetuate the long-standing industry problem of missing enrollment timelines. So what do I mean by good, thorough planning? I mean setting the right expectations up front. Too often we plan using aggressive, unrealistic timelines, and we do it for various reasons. One is based on a simple back calculation using the projected date that we expect to file the investigational product. But a more famous one that I like is that a few KOLs tell us they can enroll the patients needed in a short period of time. Now, KOLs are great at giving us feedback on a trial. When it comes to the quantitative information, however, it is important to also leverage the wide array of clinical trial intelligence information available, some in the public domain and some through paid subscription. So during this discussion, I will share a few of the best sources for this type of clinical and trial intelligence information. What we have here are the products of a good feasibility process. Notice that I do not have a list of sites as one of those products. A site list is indeed important, and it is in fact a key deliverable of the feasibility process. But what we're really looking for is a process that delivers predictability and speed without compromising quality. So your feasibility process should address these three dimensions. Now I'm here representing Inventive Clinical Trial Recruitment Solutions, which is an integrated feasibility, clinical informatics, patient recruitment, retention, and engagement business unit at Inventive Health. We were specifically created to assemble a set of capabilities that would deliver predictability and cost efficiency in clinical trial planning and execution, especially around the feasibility and the patient recruitment space. So in this regard, we're here to challenge everything the industry thinks it knows about activating and accelerating clinical trials. For a long time, the industry has been making the wrong assumptions on how long it takes to enroll a trial, how many sites are needed, in which countries, and how many patients per site. The biggest mistake is assuming that investigators themselves will produce all the patients needed from their existing practice. For us, it's all about hitting timelines, of course without compromising quality. And for me, this starts with a good feasibility assessment. This is the first place we challenge the industry's assumptions. Now, I know that I don't need to tell you how costly it is to miss enrollment timelines, but I will anyway. According to Gartner, it costs $37,000 per day in unexpected operational costs, and many millions more in opportunity costs depending on the product being developed.